Hello everyone, I'm Dr. Sowmya. In the continuation of our series on allergy legends, today we are honored to have the presence of Dr. P. Anand from Bangalore, Karnataka. Sir is an eminent allergist and ENT surgeon from Bangalore. Sir has been mentored by Professor Jack Pepys, who has perfected the technique of skin prick test, and Sir has established the first allergy immunology clinic in Karnataka in 1978. Sir has been blessed with the mentorship of Professor Roy Patterson, Professor M. Subbaya, Sir, Professor N.D. Purushottam, and Dr. B.G. Badrappa, Sir. Dr. Anand is a former president of Indian Academy of Allergy and is the founder, vice president of the Academy. Sir even is from an ENT background, but has done exceptional work in the field of allergy immunology. Sir has lot of chapters to his credits and various publications in national and international journals. Sir has been the convener and organizer for various national level physician training workshops in allergy, asthma, and applied immunology. Apart from Sir's interest in allergy, Sir is a very passionate advocate of environmental protection. Sir has been the convener of workshops and under the aegis of Indian Academy of Allergy and asthma and allergy from 1992 to until 2014. From 2015 onwards, Sir has been successfully convening one-year course in allergy and immunology till date, with emphasis on educating various physicians with various backgrounds, at least who have completed their postgraduate training, and empower them with knowledge of allergy and immunology. Sir, thank you so much for joining us for and giving your time for this series on allergy legends. I think we are really blessed to have your presence because I think you're such a person that I think you do so much work, but you're so humble and it is really difficult to get you on board for this. Thank you so much, sir.
No, I must be really thankful to you and the organizers of this. I think it's a very interesting thing that you are doing because it elevates the psyche and the very system of an individual who has been in this practice in any field. And I think what you are doing, especially for allergy, is highly appreciable.
Thank you, sir. Sir, to start with, can you briefly tell us how you can describe yourself as a person, sir, not as a medical professional? How would you put yourself as a person? Because we have heard or read about yourself, but we want to hear it from you in person, sir.
Okay. I am from a village in almost the central part of Karnataka, near Hospete, Hampi, Tungabhadra Dam. My ancient village, Narayana Devarkere, got submerged in the reservoir of Tungabhadra Dam. And we were in Madras state at that time, and they did a wonderful thing, and we were replaced to another place called Hagari Bommanahalli in Ballari district. I grew up there. My parents are my first gurus, and they gave me a lot of unconditional, unlimited love and affection, and they brought me up very, very nicely, and I'm really grateful to them. They're like God. Then I've had so many teachers, both in primary school in the village and in the Varla High School, a Christian mission school in Ballari, then in Ramakrishna Vidyashala in Mysore, and again in Bangalore in Vijaya College, and in Jawaharlal Nehru Medical College in Belgaum, and back to Bangalore. And then Dr. N.D. Purushottam, especially, who was my chief and my senior, and then Dr. Rudrappa, B.J. Rudrappa, who was in practice. They have given us a lot of help and encouragement. And then Dr. Hiranandani in Bombay. So many people have contributed to us, and I'm really grateful to all of them. They're like God. They're like God to many, many of us.
Sir, thank you.
So
I think
I
that
was in
speaks of so much humbleness of you, but we would want to hear about your further education and how you progress, sir.
no, I did my schooling in a town called Ballari, which is a district headquarters in Karnataka. And then I studied in Sri Ramakrishna Vidyashala in Mysore. Then I did mathematics, but I didn't want to join engineering. And I was deeply interested in literature at that time. But then my father said, you become a professional. So I took another year of PUC in Bangalore in Vijay College, did my biology in PUC, and then went to study MBBS in Jawaharlal Nehru Medical College in Belgaum. Wonderful institute. From then I came to Bangalore, worked in Bowring Hospital. 1964, after I completed my PUC in Mysore with mathematics. But then I didn't want to join engineering. And my father said, because I was deeply interested in literature, both Kannada and English, he said, what will you do? You become some professional. So I joined again PUC with biology in Vijaya College, and a great institution again, and very good teachers, and I did well. And then my teachers were excellent, and then I joined medical course in Belgaum, Jawaharlal Nehru Medical College, wonderful college. From then, I returned to Bangalore after my MBBS, and I was in Bowring Hospital as a compulsory house surgeon, and I was actually interested in pediatrics, and Dr. Benakappa was the professor, and he had told me, once you complete there, you come and join me, you will become a pediatrician. But then once I entered into ENT and Dr. Purushottam's guidance, then I knew this is my field. So ENT was very much nice to me, and I was passionate about ENT practice. Then what we observed during those days is 74, 75 was that a huge number of patients who were visiting the outpatient department in Bowring Hospital. Bowring Hospital during those days, okay. In Bowring Hospital those days, 1974, 73, 74, 75, in the Department of ENT, and Dr. Purushottam was there, and then he was very, very encouraging and inspiring me. And we used to get many patients, especially the younger patients, children, who had complaints and came to the Department of ENT. We definitely felt that the main cause was allergy, and there were so many other different conditions and morbidities and comorbidities caused by other complications. It is that time that he asked me to seek the guidance of Dr. Santosh Katkar, who was professor of ENT in All India Institute of Medical Sciences in Delhi. And then when I contacted him, those were different times. We didn't have any cell phones and all that, no internet. And he was so good. He guided me to connect to Vallabhbhai Patel Chest Institute in Delhi University. That's where I contacted them, and I went for my basic training in clinical allergy and immunology.
Sir, I think your You did mention about your first instigation, I mean, how you came into the practice of allergy, and you mentioned a few of your mentors. Uh, Sir, how did you navigate the limited opportunities in allergies back then? I think it must have been very difficult, and because there is no structured course for allergy back then or even now.
See, I was quite active in ENT practice, though I was just a beginner. But then I was made the secretary for ENT Association of Karnataka, and for 3 years I was the secretary, and those were different days than compared to now. And then I was quite active, and then there were several colleagues, especially in Bombay, Dr. Hiranandani, very senior professor here, Dr. Rudrappa and Dr. Purushottam. They encouraged me. They said, you come in, don't worry, things will happen. In fact, Dr. Hiranandani said, you come here to Bombay, we will establish a very good allergy clinic. They were such great people. We were fortunate to have people like them. And then I made a, so what was very convincing for me is that I used to observe and make notes of many of these patients, especially children and adolescents who were operated on for allergy, nasal allergy, and then I used to observe that there were so many complications caused by surgical interventions. And then Dr. Purushottam used to guide me to read Niga's book on nose. And then when I read the physiology of nose and then learned so many things about it, then I felt, oh my God, this is like Bible. This is like Veda for us in ENT. And that's what made me to get into allergy. And then I think basically maybe God's own guidance also. And then I went and joined the VP Chest Institute and then returned to Bangalore. And then in October 1978, I commenced my allergy immunology clinic.
Sir, I think you mentioned your interest in literature. I think their loss is our gain, and your decision not to stay back in Mumbai was Bangalore's gain to get such a mentor in allergy and immunology. Sir, in your illustrious career, I think you have had so many moments. I think if you had to relive one part of your journey, probably more, which would it be, sir?
One is that when I commenced my practice, it was on Residency Road in Bangalore. I was there for 30 years. And that time, when we commenced, and one of my friends said, and then there is no other organized clinic, not only in Karnataka, in the entire South India. There may be one or two people practicing allergy, but not organized. So it is a good idea that the government, we will request the government to send a senior person. So the health minister was there to inaugurate my clinic on 11th October 1978. And that also attracted a lot of media attention. That was my fortune. And then there were so many people who had respiratory allergy and asthma also. And then, so the practice was not difficult at all for me that time. In fact, I had to give up my surgery and I had to give up my main ENT practice because I was overwhelmed with allergy practice. And I think I was highly successful, fortunate, highly blessed by many things.
Sir,
and I started the practice and then what happened was I was also interested in doing something, and then I started doing studies, and then in 1979 itself, I had presented a paper in All India Conference of the Indian College of Allergy in Srinagar, Kashmir, and then those two papers, I was lucky, they were selected for publication in the journal. These good things happened, and then I was greatly interested, and then I did not stop there. And then 1981 or 82 Shimla conference. After that, I thought I should, I tried a lot to get in connection with a botany department in Bangalore. And I was fortunate to find Dr. Shipa Dagashe, who was a professor of botany, who was also interested in aerobiological work. And we made a representation to Indian Council of Medical Research, and we were fortunate to get a research project under which we had 5 research fellows who became PhD students, and later on they became lecturers, professors also. I think you know Jacob Abraham. He
Yes,
was
sir.
one of our students in that ICMR
Wow.
project, and we had very good students, Manjunath and several others. And we also published a lot of data, and both on aerobiological studies and clinical studies, and they were published, and we were fortunate, and I got an award of Indian fellowship of the Indian College of Allergy in Jaipur in 1984.
Okay.
So the journey was quite, in the beginning, it was tough, but it was quite successful because I had faith in this science. I had developed a faith in this science of allergy, and that faith has never stopped, never reduced. In fact, it has only become bigger and bigger, to the extent that I want all pediatricians and all ENT surgeons and all chest physicians to get trained in the science of allergy. And we're really fortunate, and I'm conducting this course. We are getting good students. They're becoming good allergy specialists.
Yes, sir. I think it's the passion in you, I think, which fires us all to do more work in the field of allergy immunology, sir. Sir, in the recent past, I think do you think public and professional awareness you did say, because you continue to instigate in the field of education and for us in the allergy. But how has public awareness of allergic diseases changed over decades of practice you have been in practice, sir?
No, it is not just the public. It is our own medical professionals, our own colleagues, who were quite tough to understand, tough to accept this as a science. Tough. There was a lot of resistance, especially from chest physicians. I'm telling you, there was a lot of resistance for them to accept, until the GINA guidelines brought in that allergen immunotherapy is included for asthma. So until then, a lot of resistance was there, in spite of good practice and all that. We have done well, fortunately. Many of us practicing clinical allergy and immunology all over the country in different parts. I think many of us have done well, fortunate for us, and we're lucky.
Sir, what are the biggest system level gaps you believe needs to be addressed, sir? Maybe it is in the policy, because you're very active in training many medical professionals in the field of allergy immunology. But you still, what are the other system level gaps you feel can be still addressed in the impartment of allergy education in our country, sir?
I think you brought in a very good a very good matter for discussion. I think this needs to be there. There is hardly any medical college, or any major hospital which has a department of clinical allergy in this country. We have tried, but we have not been able to. But fortunately, there is a keen interest in clinical allergy among pediatricians and ENT surgeons. I see that it has become very well, beautifully emerged. And what is really appreciable is that there is appreciation, and there is a sort of a belief. There is a sort of a notable appreciation and commitment for this science. And many youngsters are getting trained in clinical allergy and immunotherapy. And I'm glad to tell you that right now, all the doctors that have been trained by us, we have included them in one system, in one platform, and they are all quite active in discussion, and I have created a platform for them to discuss various issues, and it's doing very well. And then recently, in fact, we have conducted a programs called as a program for those who are already in allergy practice, who have trained and who are doing well. Yeah, a refresher course. And that also is quite, I was so impressed when we did just the beginning of this this month. And in Goa, we did a 3 days wonderful program. And there is an emergence of very keen interest among the specialist doctors, especially. I'm so happy that ENT specialists are getting so highly so highly interested, and they're into this program, and they're asking us to get themselves registered for our course. And our course is getting very, very well done because of this. We have been able to we have tried to make it as enlarged as possible to include as many topics related to respiratory allergy and other subjects.
Sure, sir. Thank you. I think that's very important. You keep the enthusiasm going amongst the younger generation. Sir, what are the core skills or mindset you think as young pediatricians or chest physicians or any other specialty should develop if they want to continue their interest in allergy?
Yeah, I think there has to be a keen interest, and one needs to get inspired to do good work. And then once you know that allergy is a different field, and if there is allergic inflammation in the nose, and the inflammation will not get rectified, will not get treated by any surgical or such procedure, because that inflammation is allergic inflammation, and it's a systemic disease. It is not a local difficulty, local disease. So if doctors get to understand this particular phenomenon, and now compared to earlier, now there is a lot of information available on how, when you commence allergen immunotherapy, right from the very first dose, there is the function, the physiological status of the person starts getting into a totally different direction. How allergen immunotherapy commences its function from the very first dose. There is enough adequate information on this. There are some workers in Switzerland and other places in Germany who are doing wonderful work, and we have to follow them and maybe bring in these in institutional interest. I have always tried to influence and inspire people to have projects, research projects in their colleges, in their hospitals. And I think some will do far better work than what we did.
That's your humbleness, sir. Sir, what's your dream scenario for allergy care in India by the end of this decade, sir? You did mention that some research work has to be more progressively undertaken, and probably we must be active in probably rekindling the interest in the younger generation. What are the other things you think can be progressed in allergy care in this decade, sir?
I think a proper training is necessary for every specialist doctor. Getting 1 day's training, 1 day's demonstration, half a day's workshop, those are not right things. One needs to be properly guided, properly inspired, properly involved. We must involve them. And I think their youngsters are good. This country is fortunate. This is a country where the talent and hard work is the basis. All our parents, they teach us that hard work is the main important thing. I think irrespective of the language and religion and all that, I think this is what our parents teach us, and this is what the younger generation needs to be brought into this particular culture. There must be a professional culture. Somebody sends some non-medical people to urban and semi-urban places, small places where there is a practitioner, general practitioner, and patients are there, and they do the allergy test, they give the report. Those things should be stopped, and a proper scientific attitude has to be developed. This is a good field. This is a good science. This science has to be brought up, and it'll become a fantastic, great thing for human. See, if India has 140 crores of population, and if North America and Europe has an incidence of anywhere between 35 to 45% of the total population affected with allergy, if Indian population, even if we think that 20 to 25% of our patients are affected by allergy, and leave aside the mild and intermittent cases, those cases where it is continuous and it causes a lot of havoc and a lot of difficulty in the quality of life of affected individuals, even if you think it could be even anywhere between 15 to 20 crores. It's a huge number, yes, not small. That's a huge, even North America does not have such so many patients. And India, I think there is a good direction now. We're getting into same way. Medical specialties also should get into such invigorating, beautiful experience. And also we must see that the juniors and the younger specialists must be they must be involved in so many things to become good specialists, and they will become. Definitely, they'll become better specialists than we are, and we will be fortunate even for that.
Sir, we have some rapid fire questions, sir, for you. Sir, a myth about allergies you would like to bust?
Myths about allergy. Okay. Allergy is something incurable. Allergy is Allah ki marzi. These are some of the things that are being told. And allergy, even your mother-in-law cannot cure, your father-in-law cannot cure, your wife cannot cure. Things are like that are there. Allergy is a disease, and there is enough evidence for the causation, enough evidence for its status, enough evidence for its cure also wherever it is possible. See, there are so many non-infectious diseases. Among all of them, allergy is only one of them where there is a possibility of a cure.
Correct, sir. Very rightly said. Sir, your favorite scientific journal or go-to resource which you would recommend for us?
The Journal of American College of Allergy, Asthma, Immunology, and the Journal of European Academy of Allergy, Asthma, and Clinical Immunology. They are good.
Thank you, sir. So, one clinical pearl that you wish...
I think Pediatrics Journal also is good. Sorry.
Yes, sir. Please Indian Pediatrics also is good, sir. As you rightly said.
Yes.
Sir, one clinical pearl that you wish every pediatrician knew about?
One clinical?
Any clinical pearl or any clinical issue that they must be empowered to treat allergies.
Very good. Thank you. When you get a patient of allergy, the symptoms are quite clear, quite awakening. please spend enough time with the patient and the mother. Mother is the main anchor of the family. Mother will do anything for her child. And if you suspect the condition or the complaints of a child are due to allergy, please spend enough time and see that the treatment is not just writing some antihistamine or an intranasal spray or something like that. We have to spend enough time to see that the treatment becomes comprehensive. It is not, I'm not saying that every patient of allergy needs allergy testing and immunotherapy. When there is a cry for a cure, when the symptoms are more than mild, when the symptoms are affecting the quality of life of an individual, when the sufferer is a child, because we know that the inflammation of allergy will not keep quiet. It will, in spite of the medication, allergic inflammation will be there, and it can even get expanded. It can become enlarged. So it is an inflammatory disease, and we cannot simply say that, okay, I'm giving you an intranasal spray like a fluticasone or mometasone, and after 15 days you stop it. No way. When the disease is mild, when the disease is not affecting the real quality of life of the child, everyday's life, then it's a different matter. But when the disease is affecting the child's quality of life and it is moderate or more than moderate, please see that the child is properly treated, properly guided, and see that allergen testing and immunotherapy become one of the tools of your treatment. Whatever I said, did you hear? Did
Sir,
it get recorded?
allergen immunotherapy has to be incorporated into practice is what we could. After that, I think it got disconnected, sir.
See, what is necessary in India is, I hope I'm audible enough.
Yes, sir. Yes, sir. Sir, you're
What
not
is
visible,
necessary?
sir.
Yeah, what is necessary?
Yeah, you are visible, sir,
Sorry?
now. Please go ahead, sir. Please go ahead. Sir.
Okay. At this moment of time, what is necessary for us is to see that the patient and the patient's family, when the patient is a child, a pediatric patient of allergy, and then the doctor treating and the institution where the child is studying, all of them need to be sensitized, need to be educated. So we need to see that they're all properly educated. They have to know what is allergy, and they have to know that this is not just a difficulty. It is an inflammatory disease. There is inflammation, and that inflammation can only increase if you do not address it. Please see that the inflammation is properly addressed.
Sure, sir. Thank you, sir. Sir, one allergist in India whom you admire. Any one of your gurus, you have told so many of them, sir. I'm being a little partisan, but one person whom you really admire and look up to.
There are so many, I think, and if I just admire one person, it may not be proper. But in the West, from whom I have learned, Professor Pepys, he was so good. When he saw my first publication, he had come and he said, you have to come to England. See, and then there in England, in the city of London, right in the heart of the city, where he was a professor there, and I used to be there, and he used to observe the attention that I used to give, and he used to encourage and he used to appreciate the long hours that I would spend in the hospital and with the patients. And he would in fact tell others also, look, this guy has come. from India, and he's young and he's so enthusiastic, and he comes from a country who we think who the country we think are not so well initiated and all that, but they are far better. Look at that. Look at the way he treats the patients. Look at the way he examines. Look at the way he spends his time. These are all the things that I have learned from my teachers, whatever I did. And that was appreciated by Dr. especially Professor Jack Pepys. He was so good. It is difficult to get such teachers now.
Sure, sir. Thank you. Sir, before we let you go, sir, if you weren't a doctor or ventured into the field of allergy immunology, what would have you been, sir?
I would have definitely become an English teacher. Teacher, whether it was school or college, it would matter to me. I was so much highly initiated by the book, and I still am a great fan of several English poets. There are some places in Switzerland. If you go to Rome anytime, there is a particular place where these poets in England, they were pushed out of the country. They stayed. They were from very rich people in England, but they had to leave the country, otherwise they would have been killed. And they stayed in Rome, and that place now has become a memorial now. When I see that, I get goosebumps. And so I simply love their writing. In Kannada also, Kannada writers are great. Kannada language is so beautiful. It is so phonetic.
Yeah, I see that your passion for literature is so much, sir. I think, as I said, I think the loss to the literature field is our gain. To have you as a mentor and a teacher in the field of allergy immunology, sir. Sir, thank you so much for giving your time. Sorry, sir. Please tell. Please.
I have published Kannada articles in Taranga, a very well-known magazine, on the science of allergy. Also.
Wonderful, sir. I will look it up, sir. Sir, thank you.
My mother was a great inspiration.
Sir, I hear that, sir. I was reading up about when I was preparing for your talk. I saw that you have a lot of interest in literature, especially and your contributions in Kannada and English literature, where you have published not only in Taranga but various other platforms also in both English and Kannada. And you're so passionate about environmental conservation. And I came across many publications from your end where you have spearheaded to in the local areas about stewardship, about environmental conservation and other very good initiatives, sir. I think overall, I think you come across as a very...
Itself, 5th
yes,
June.
Sir. Yes, sir.
5th June in Tiruvannamalai, Sri Bhagavan Sri Ramana Maharshi's ashrama. We did a public activity function there in bringing up the people's attention to environment near the Ramanashrama there.
Sir, I think it would be very wrong for me to say that we keep you limited to allergy and immunology. You come across as a very wonderful human being, a great teacher, and a very good social influencer, sir. So thank you for sharing your wisdom and journey with us, sir. And thank you so much for giving your time and for apart from the whole team of Indian Academy of Pediatrics National Allergy Chapter. I thank you for giving us your valuable time and insights about your life. And I hope this will be more inspiration for youngsters like us, sir. So thank you so much, sir. Thank you.
No, I have to really thank you and congratulate you, your academy, you and several of your colleagues, both senior and juniors. Please tell them my thanks. this is a fantastic, very, very novel initiative raised by you guys. And there are so many, more than 470 students who are practicing allergy specialists, both in the country and outside. I'm so happy. I'm so blessed. They love me. They treat me so well. I'm really happy. And you are so good. So I'm so good. And you have brought me into this. I have to really thank you very much. Please thank all your colleagues.
Sure,
I'm
sir.
very, very thankful to all of you. God
Thank you,
bless
sir.
you all.
Thank you, sir. Thank you so much for your blessings, and we look forward to your insights in the future as well, sir. Thank you. Thank you so much.
Oh, yes. Anytime. Anytime.
Thank you, sir.
Thank you. Namaskar.
Thank you, sir.